We are here today as within the setup of the PSS, we've been clustered into various clusters. The team that is here today is the social sector cluster, which deals really with the main issues in social sector, health, cash transfers, and we have women and gender issues, we have sports, we have youth. So this is mainly the social sector. So today we are here to be able to appreciate within the social sector what is happening within the country and to be able also to communicate to the citizens what government is doing within the commitments that we did. You know, within the bottom-up economic transformation agenda, there are certain things that Kenyans and wananchi were promised, and we are coming back to engage within the social sector some of those things that we say. In the education sector, we know about education reforms and the reforms that are ongoing, the Presidential Working Party report, which is now being dealt with, the various legislations that have come out of it, the sessional paper. When it comes to the health sector, the universal health, and PS Kimtai will mention a few things, mainly about registration under the social health authority. So we are here today to engage and to have engagement with the citizens so that we can give feedback and we can also hear from them what it is that they think we are still yet to meet as per our commitments. So here today is about that engagement. It is really nothing else but an engagement and also to appreciate what's happening in the countryside because we must be able to get in touch and to maintain contact with our people so that every other time we are able to appreciate and we are able to properly plan. The other day, and it is still ongoing, we were having sensitization on the medium term plan 4, which is the guiding principle for us in the next 5 years. So it is part of that engagement with the citizens and be able to relate to them what we are doing as government and also to hear from them what they expect from ourselves. So that is why we are here today. But I know there has been, today we engage mainly in the whole on issues of Women Enterprise Fund, the Youth Fund, the cash transfer and the Inua Jamii, and the issues that is around the universal health. So I will allow my colleagues and then eventually the deputy governor and the regional commissioner will just give us an overview on security around the region. But before then, I will request the PS for health to say one or two things about the social health authority because I know that is the most urgent thing that we are doing now as we register people into the social health fund.
Thank you, Chair. As mentioned by the Chair of our committee, we are indeed here to engage with the members of the public and also to have a chance to visit some of the projects that are being undertaken by the national government in the respective departments. Today, I just want to brief you that indeed, since the laws that are reforming the healthcare system were passed last year in 2023 October, we've engaged further, and now one of the key implementation program that we have is transfer of the National Health Insurance Fund to the Social Health Authority. Effective this month, on the 21st, proposed date, we are going to announce to the country the procedure or the process that you are supposed to go through in terms of registration so that you will now be registered to get services effective 1st of July under the Social Health Authority. We take note that most of you were in NHIF and you will be transferred. You will get a message informing you that now it's the right time for you to migrate your data so that it can be used under the social health insurance. Under that, I want to mention that the Social Health Insurance Fund is different from the National Health Insurance Fund in the sense that the Social Health Insurance Fund, authority, manages three funds. The Primary Healthcare Fund, which will be used basically to cover all our citizens who seek services at level 2 and level 3 within the counties. Then we have the Social Insurance Fund, which is basically a contributory fund where every member who has registered will pay their annual subscription. And for those who are employed, they will be deducted a monthly subscription and they will be able to get or access service at our level 4 facilities. That is a social health insurance fund. Then the third fund is the emergency chronic critical illness fund, which is a fund that will be appropriated through our National Assembly. Again, that fund is mainly supposed to support those who have critical or chronic diseases and their social health insurance fund is exhausted within that particular year. We've all had cases we've seen where most of you are put in WhatsApp groups because we need to contribute to a family or a patient who is still undergoing, say, treatment, chemotherapy in the hospitals, and they have exhausted their insurance fund, and therefore there is need for additional funds. Now we are saying there will be no need for additional funds if you have exhausted your insurance fund. That's where the fund has been set aside to cater for such cases. It's actually called emergency because at any other time, you can also need emergency treatment, accidents, and other emergency cases that happens, disasters that happens, and we need to treat our patients immediately. That fund will be able to cater for everyone who is under emergency. It will cater for everyone who has a chronic disease, as long as it has been, we have seen the progress of your treatment. And I was just informing the members of the public that there is no more selection of hospitals in the sense that we have digitized our healthcare systems, where any place you go, you will receive treatment because your records are within the health ecosystem, what we call the digital superhighway, under the what's called the Digital Health Authority. So that's one of the acts that was also passed and approved or ascended by His Excellency, that Digital Health Act 2023, then brings all the facilities, both private, faith-based, and public, to ensure that they're able to communicate, they're able to know when a patient goes to a private facility or when you go to a public facility or you go to a faith-based facility, all your data will be there. What we want to do is basically track what's called the patient journey. You should be treated anywhere and your ailments will be known when you go to a different facility, not that you want to start afresh. Basically, those are the reforms that we are talking about in the health sector. But the key one now is our payments, our registration for social health under the Social Health Authority. Thank you. Any other question?
Thank you. I think what we can go for now.
Huh?
Let's for us to guide.
There is a question, Chairman.
Quickly, we get around 3 or 4 questions.
There's a question, Chairman. They're asking that there is a red eye outbreak of red eye disease here in Nakuru. I think we have just been notified, and I've talked to our team together with the team of Nakuru. In fact, we are going to PGH. We are going to meet the doctors. Our public health officers, I'm sure, will go and start collecting data and see the cause of this outbreak, and then we'll give you measures on how to contain the red eye disease. So that will be addressed once we get the full details of that outbreak.
So quickly, 3 questions, maybe, so that we can run to the hospital.
Yes, please. Mochari on Inua Jamii at the status.
Oh, I thought that one I clarified. Thank you so much. I think this had been well covered by our chair. Yes, on the cash transfer, which we do every month. As you all know, Our Excellency the President, Dr. William Samoei Ruto, did guide that we transfer the way we have been doing the cash transfer from bi-monthly to monthly, which we are now doing. And we do this every month. Like now, as we talk, we have already done all the months. We are up to date. Yes, the question is what we are doing for the new ones that we took last year, September. We are now opening the accounts, and this month we are going to pay their cash stipends. So we are up to it, and we already have the funds from the exchequer. But I also want to mention that please, the members of our for the state, we are here, yes, as principal secretaries on behalf of Our Excellence the President, to explain and get questions what we are doing, to see the parameters, what we promised, have we achieved? The answer is yes. We are really trying to achieve as a government. But I'm asking those of us who are here, the members of the for the state, that it is important for us not always to be on the negative. Let us make sure that this is the issue of taxes. It is very important that we pay the taxes for us to get the funds. This cash transfer is fully dependent on the exchequer. We do not receive any funding of the cash transfer from any donor funds. So unless you people, you don't want us to get the cash from paying the taxes for me to pay the cash transfer to the only people, then that is where the problem is. So I'm as requesting that please let us honorably pay our taxes, and then on top of payment of our taxes, I should be able to getting some little money that I pay these old persons. In the room, I said we are paying 32 billion every financial year. That is good money. And all of it is fully dependent on our exchequer. So it's quite heavy on the exchequer, and but we have to do it because we are the government. Thank you so much.
Just to follow up on that, while we were inside, there are some of the people who are eligible to that one who are requesting for an increase. So are there plans to have an increment for what they call the high cost of living and the economic climate? Are there plans?
Yeah, it is a common question, it's a common concern that everybody feels the 2,000 is not enough. That is why we are here. We want to take up the queries, and we see when our economy improves, of course, we should be able also to improve the cash transfer. But once our economy, we get out of the hole that we are in. Thank you.
Question was to education, and TSC had required 700 JSS teachers, and Kuwait has now issued a 14-day strike notice over that. Maybe is there any engagement with the ministry on that matter? Will these teachers be brought back?
I think what is there, it is a labor dispute, and all labor disputes have their own ways of being dealt with, and even this one will be dealt within the framework that we deal with the labor issues. Yeah.
Thank you. Thank you. All right.
Yes, yes.